Hi guys, a very good evening. Masquera say. Vice President Chiwenga was reportedly admitted in a hospital yesterday, but he has, however, come to clarify that position and said he was not hospitalized, he was not admitted, but he went to visit at the hospital itself to see what was happening there. And his reasons are that he wanted to actually upgrade the local hospitals. So that is the reason why he had to visit. Let us get into this story.
They forget I'm Minister of Health. I've gone to see, new ideas, new equipment, and all the ideas. My brother wants to do open heart surgery. What's wrong with people? I should never visit. I should never visit a friend who is who has got a surgery or a clinic or a hospital. Now, how do I visit my hospitals?
So basically, this is a good idea if he genuinely visited this hospital from his heart. That is a very good idea. But let us look at these points vividly. Number one, he said that this hospital should need to conduct open heart surgeries, which is a good initiative if that is going to happen in the nation of Zimbabwe. But the question is it viable for poor people? Are the poor people going to afford? Because at this moment, the rich are the only people who afford that. So are the poor people going to afford that heart surgery procedure from this private hospital? Are they not going to be charged exorbitantly? As a minister of health, he was supposed to actually be concerned because of that. Secondly, the thing is that the reason why people are talking is because he has not visited Parenyatwa, he has not visited Harare Hospital, Bulawayo Hospital, Lanampilo, and so forth. He has visited a private hospital for all those things. He has not gone to Parenyatwa to actually see the state of cancer machines there. He has never visited it. He doesn't care about it. He cares about visiting his friend's hospital, which is planning to open about a heart surgery there. Whilst people are actually dying of cancer at Parenyatwa hospital and not being treated at this moment, radiotherapy is not working around Zimbabwe. No hospital is offering radiotherapy. The Minister of Health does not look at that and does not care about that. Who is going to actually speak about that if he continues to turn a blind eye on such issues? Let us look at the state of the hospital in general. There are no drugs in the hospitals. If you go to actually get treated at big hospitals, you usually always go to buy drugs outside the hospital. That is a huge problem. That is a very big problem. We expect the VP, who is the health minister, to actually visit those hospitals, speak to the patients, see what is really happening at those hospitals. He doesn't need to speak to the leaders or to other people at that hospital. He needs to speak to the patients directly to actually hear what the patients are actually experiencing. Another issue is that the VP has not visited the workers, or the health workers, has not had a meeting with health workers. At this point in time, we expect to see the VP actually talking to the people of Zimbabwe, the actual workers who are working at the hospitals, to sit down with them in an open meeting. There is no boss, there is no nothing. Everybody is free to speak his or her views regarding what is happening, so that the people will be able to actually tell him the truth. So that is what he needs to do right now. But he's actually coming to to make a video. This video does not change anything, because what is happening at the hospitals is so sad, because he has done nothing so far to make sure that there is medication in our hospitals. So these are the issues of concern. This is the reason why you see people are so much concerned and are so much speaking about what is happening. If you had given himself an opportunity to read the comments about what people are actually saying regarding his hospitalization, you would see people are not happy, people are angry, but it's because they don't read those comments on themselves. They rely on hearsays from their aides, but their aides, you cannot actually go and tell your boss with boss pana pakatonyorwa unzi hanzi muridora anongoti hapana vari kutukai boss pana vari kuita sei, but they will never tell them the truth. So this is what is happening in Zimbabwe. VP Chiwenga clearly said that he was not admitted at any hospital. He went there to visit and to see the open heart surgery, which is being about to be opened at that hospital. That is what he said. So I don't know what you think. We were not there. That is what he went there to do. So I was just giving my own views regarding the point which he raised when he said teachers of Visitira Edu Same hospitals. And the question is, for how long? This is August. From January, radiotherapy machine has not been working at Paranyatwa Hospital, and if you go to UBH Kilo Hospital, they don't have those procedures, and the Minister of Health never visited those facilities. It means radiotherapists they don't have anything, any job, any work. So it is their right, according to the employment rules and regulations. It is their rights, radiotherapists, to actually demand basa kubva kuhurumende kutoenda kuna vachiwenga chaiko vonoti vice president isitiri kuda basa hatina basa. It is within their scope of their rights to actually demand work, because when they are seated, when you are seated every day, sometimes how are you going to be experienced? How do you count your years of experience? With I have 10 years experience. For the past 2 years any radiotherapy activity, but you were at work. These are the issues zvinozokanganisa ma-health workers vedu. Vakaenda kune dzimwe nyika, other countries will look at those issues and say, you were in Zimbabwe, yes, but the radiotherapy was dead from period A to Z. What were you using? And ukaita mnyama unenge waenda usina anything from any private hospital between that period. So these are the disadvantages our people are facing. So not only the cancer patients are disadvantaged, also the radiotherapists themselves, they are disadvantaged. So this is it in Zimbabwe. I don't want to take much of your time. In the comment section, please tell me, what do you think about what is really happening in the health sector? Thank you very much for coming.